Hey, Dr. Derek Nielsen here. Are you still struggling with low back pain? Is it keeping you up at night? Are you feeling stiff first thing in the morning? It loosens up throughout the day, then stiffens up again when you sit down. Is this just a cycle that's going on day in and day out, and it's become your new normal? Well, here's what I want to do. I want to give you 2 exercises to start finding a resolution to that low back pain today. Now, if you watched my last video, you'll remember me talking about getting more mobility in the upper back. Well, today I want to look down the chain and I want to get more mobility in the hips. Now, pain really is just a symptom. It's usually not the area that you feel pain, which is the area that needs to be worked on in order to find a long-term solution to that pain. Okay? So what I want to do today is get some more mobility in the hips. So we've got one up above and one below, so the low back is able to take a break. You're going to need, in the last video I showed you with a foam roll. Well, today you're going to need a little ball here. So this is just like a little kid's basketball. It's got a little bit of air in it. It's pretty soft. I don't recommend using a lacrosse ball in here. They seem to be a little bit too hard, and you can hit a nerve and feel some tingling, which wouldn't be good. If you can't find one of these little mobility balls, I do have them. I give them to every patient that comes and work with me, and reach out to me and I'll send you one for free. Alright, so let's get a little bit more mobility in the hips. What you're going to do is lay on your back, and you're just going to put this ball right in the hips. Next you're going to do, and this is the important part, is you want to allow your knee to fall out to the side. When it goes out to the side, you should feel a little bit of discomfort, some tenderness, or some tightness in the area of the ball. Okay, you'll want to relax into the ball for about 3 minutes. Alright? Then you would switch and you would do the other leg. 3 minutes on each side. Now, if you're not feeling any tenderness, tightness, or discomfort when you use the ball, what I want you to do is, you'll notice I'm on a soft surface here. Just get onto a little bit of a harder surface, like say the ground, and try it there. 3 minutes on each side. So we gain mobility, and then we want to challenge that mobility. We always want to get mobility where we need it, and then we want to do an exercise that challenges that mobility, and that tends to make it stick. Alright, so the next one we want to do is called hip drops. You'll get back on your back here, and then you're just going to allow both legs to go to the side. Now, the important part with this exercise is you don't want your low back to move. So you'll notice if I go too far, my low back's just going to lift up. And then that means that I'm getting the mobility from the low back. I want to get the mobility from the hips. So you're just going to go to the side as far as you can without the low back coming up. Once the low back comes up, that means you're done. You've gone far enough. Then you're going to go to the other side. Scoot over here. You're going to go to the other side, and again, don't let the low back come up. And you'll just go back and forth, challenging that added mobility that you got with the ball. Okay, now this is you using it. Don't let the low back come up to either side. Okay? You do about 10 reps to each side, and then that's it. I would recommend doing this first thing in the morning when you feel stiff and tight. You can do it as many times as you want throughout the day. And the other time I would recommend doing it is before you exercise. Alright, if you're wanting to get help right now, what I do recommend you doing is reach out to me. I'm available to talk on the phone. Just click the link and let's set up a phone conversation where we can discuss exactly what's going on with you, if I can help, or if I can guide you in the direction of somebody that can. Alright, talk to you soon.